turn it over to I will turn it over to Michelle Leek, President and CEO of the Colorado Health Institute.
Great. Thanks, Joe, and good morning, everyone, and welcome to the July edition of Eggheads. This is CHI's monthly webinar series. We present these on the third Thursday, or the morning of third Thursday of each month, as a way to start to get our community together, virtually for now, but in person very soon. And we like to showcase and talk about, showcase our work and talk about current health policy topics. As most of you know, I'm Michelle Leek, and I'm the president of the Colorado Health Institute. We're an organization that's based on the belief that good health policy leads to a healthier Colorado. And where our job, our focus is to bring research, insight, and expertise to leaders across the state, because informed decisions lead to better health for all. We're an independent and nonpartisan organization. We do work for the public benefit that is funded by philanthropic supporters. And we also consult with agencies, including community groups, hospitals, payers, government agencies, and foundations to provide not just analysis and data, but strategic planning, facilitation, complex modeling, evaluation, and strategic communication. I'm always happy to connect with you if you'd like to learn more about CHI or how you can support our work. This morning is all about maps. First, Guadalupe Solis and Joe Hannell will share with you maps of COVID-19 diagnoses at the neighborhood level in Metro Denver. We're excited about this because, as far as we know, this is the first geographic data on the COVID-19 pandemic that is publicly available in Colorado below the county level. And when it comes to analyzing and making public health policy, the more detailed the data, the better. And second, we have a very different kind of map, a financial map of the American Rescue Plan. We've heard a lot about the $3.8 billion from this bill that the state legislature will have authority over. But we've identified nearly $10 billion that hundreds of different entities in Colorado are receiving from the rescue plan. Our aim with this financial map is to help everyone work together and amplify the good we can do with the infusion of dollars. Joe will share the maps with you in the second part of this morning's webinar, so stick around. And with that, I'll turn things over to Joe.
Well, thank you so much, Michelle. I'm Joe Hannell. I'm the Communications Director at CHI. I have a couple of technical notes. First, the webinar is best viewed if you use Speaker View. That's the button at the top right of your screen, rather than Gallery View. Questions you can dump into the Q&A button right here during the at any point during the webinar. We will take most questions at the end of each segment, but we'll probably ask for a little bit of audience participation during the presentations. There's also a chat function right about there on my screen. If you're using that and you want to talk to your fellow attendees, which we really encourage to try to replicate the buzz of actually being in a room together, make sure you're going to, the chat is targeted to everyone and not just the panelists. And now the map you're about to see, it's live right now on our website, but we're gonna wait until the end of this part of the webinar to share the address, because we don't want a lot of people crashing the GIS server while we're trying to do the presentation. So with that, this is my 7th year at CHI, and for the past year, we here at CHI have been on a quest to bring more localized data about the coronavirus to people in Colorado. And I'm just thrilled to finally be able to share with you the results of this project that I worked on with my colleagues, Guadalupe Solis and Lindsay Whittington. Guadalupe is presenting with me today, and I will ask her to introduce herself now.
Hello, everyone. Good morning. Thank you, Joe. My name is Guadalupe Solis, and Okay, I am unmuted. I just wanted to make sure. It is good to be with you bright and early today on this Thursday. So a little bit about me. I have a master's in public health from the Colorado School of Public Health at Anschutz Medical Campus. My studies were focused primarily on epidemiology and health systems management and policy. Both of my parents attended Denver North High School, and all of my aunts and uncles on my mother's side are proud Northsiders here in Denver. As my family aged, we moved to Arvada, and this is where I grew up and attended Arvada Senior High. As you can imagine, the communities of Denver hold a place in my heart, and this is why I'm here with you all today. At the Colorado Health Institute, I am a research analyst, where I have been for the past 2 months. And before this, I was an epidemiologist at Denver Public Health and worked primarily on work to support the city's COVID-19 response. It really was here that I understood the epidemiological patterns in disease distribution of COVID-19 and the related social factors playing into these patterns. I am very much looking forward to going over what we have planned for today. As mentioned by Michelle and Joe, for the first time, we were able to show the geographic distribution of COVID-19 diagnoses for the entire Denver metro area. And we're going to dive in a little bit deeper into the chosen indicators that are related to these geographic patterns. Thanks, Joe.
All right, thanks, Guadalupe. So we'll get to the maps in just a moment, I promise. First, I'd like to frame up our takeaway lessons from this project and then go over what these maps can and can't tell us. So first, our takeaways. In the hardest hit regions of the metro area, the rate of COVID diagnoses was 10 times greater than the ones that fared the best in this analysis. So that's from a 25% of the average to more than 250% of the average. Very large variation. And often a drive of just 10 minutes separates the neighborhoods that fared the best from ones that fared the worst. Quick example here is that we'll go into a bit more is Platt Park and Westwood. In the foreground of this aerial picture is Platt Park. That's if you're from the Denver area, you might have shopped on Old South Pearl Street or gone to some of the restaurants in that area. Pretty, it's a well-to-do area. And then at the top of this map, really literally across the tracks from Platt Park is the Westwood neighborhood. This is kind of the western gateway to the city of Denver from Lakewood. And it's a place where we see it's just had a lot of historic disinvestment, and we see a lot of poorer health outcomes in Westwood. And then that feeds into our last takeaway. The highest diagnosis levels were found in neighborhoods where residents had lower education levels, higher concentrations of non-English speakers, and people of color. So historically, a lot of systemic factors have harmed health in neighborhoods with these characteristics, including discrimination, lower incomes, lack of access to care. And this is also where a lot of people work in face-to-face jobs. They couldn't protect themselves by telecommuting. Next, a bit about the data and how we can use these numbers. The numbers come from CORDS, which is the Colorado Health Observation Regional Data Service. It's the brainchild of some forward-thinking folks at Denver Health, Kaiser Permanente, Children's Hospital, and some other providers. And they thought, why couldn't we use anonymous data from electronic health records to provide a really good source for public health research? Well, it took years of work, but we here at CHI helped set it up, and Denver Health and other providers are playing indispensable roles in keeping it running and fulfilling that vision and providing this data. That is what you're going to see numbers from CORDS today. So CORDS data now includes about a quarter of the population in the 7-county Denver metro area plus Larimer and Weld counties. So that is the population we're talking about today. The maps that you're going to see don't cover the other 56 counties in Colorado because CORDS doesn't cover them. And the maps also aren't a straight up count of COVID cases. Instead, I like to think of it as like a robust sample that gives us a good indication of the pandemic's effect in various neighborhoods. We can compare the neighborhoods in the study to each other, but not to areas outside the study. That's just not a valid thing to do. Okay, enough prelude. Let's look at the map, and I'm going to share my screen here to do that. All right, hopefully you should be seeing a view of the Denver metro area extending up to now Greeley. So to orient you, here we have Interstate 70 running through the city, Interstate 25, north to south. And the darker tones on this map, the darker oranges, are areas where the relative incidence of COVID-19 diagnoses were higher than the average tract in the study. Light yellow is the lowest, and dark gray, those are, or just gray, those are tracts that are not in the study. Either there were too few cases, and under Cord's privacy rules, the data were suppressed, or there just was no data to report. So I want to give us some time here to kind of take a look here and zoom in a little bit. Getting a bit tighter on the Denver metro area, we see this famous upside down L pattern that is that should be familiar to public health researchers. On the west side, this is roughly Federal, Sheridan Boulevards on the west side of Denver proper, running from the southwest to central northern part of town. And then across here, we have the I-70, 76, 270 triangle extending over into Montbello and just south of Denver International Airport, Anschutz Medical Campus out in this area. Those are areas that historically have had lower or worse health outcomes. And it turns out COVID-19 is tragically following those patterns. I'm going to zoom in a little bit here on two specific neighborhoods that I had discussed before. First of all, missing it. First of all is the Westwood neighborhood. Still takes me a while to be able to click directly on it. This is the census tract that's at the very western edge of Denver proper. It's where Morrison Road goes diagonally from Mississippi to Alameda. It's kind of the boulevard at the heart of the Westwood neighborhood. And here we had 266% higher than average COVID diagnoses in this tract. Then we can skip right over to Platt Park, which I showed you before, 32% of the average COVID diagnoses in this study. Housing values are way higher in Platt Park, and we posit that if you can afford to live in Platt Park, you're also probably working at a job that you can afford to do from home with telecommuting. So let me pause real quick. Does anybody want to take a look at any specific areas here? Just pop that in the chat for us. And Deanna or Guadalupe, you might need to help me out with helping view the chat. It's kind of difficult to do when I'm on this view.
Someone asked,
Okay.
Sherylwood, Broomfield, Boulder, please.
Okay, Sherylwood, yes. Okay, let's go to, let me see if we have good neighborhood names in here. And I'm typing the name, spelling it. Jill, would you give me a cross street or an address in Sherwood? For starters, for a minute, I'm going to go up to Broomfield and Boulder, which is a very interesting case because these are areas that go against kind of our thesis of what's driving the disparities here. Broomfield and Boulder are much more well-to-do areas, and we looked at these that had, say, 150% average, 235% average in East Boulder. So what's going on there? And then one of my colleagues, Deanna Geldens, reminded me that, well, this was University of Colorado was the site of a huge outbreak that really was basically kicked off the big statewide outbreak starting last fall. I've got what's the bright orange area in southwest or southeast Arapahoe, I think. That's it's out by like Cherry Creek Dam, Kennedy Golf Course, and it's not as high as some of the areas in Denver. All right, and then yeah, Sherwood Pecos north of US 36, so we can definitely do that. So yeah, Federal Heights area. We see that area is, above average, not alarmingly so, but we have, that's kind of the extension of the inverse L running up Federal and Sheridan. Okay, and I have a couple methodology questions too, and yeah, just to get the one out of the way because it's from Amy Downs, our former research director here and still a mentor. She says, just to make sure I understand, your numerator is people with COVID who are included in the CORDS data set. The denominator is all people who have data in CORDS. Actually, it's, yes, I believe that is the case. Guadalupe, do you want to chime in on that real quick?
Yes, so the numbers that we initially had calculated the denominator for the total population at the county level, but we decided that because we were showing tract level data or neighborhood level data, we divided by, our denominator was the total number of persons within a tract. And yes, the numerator, you're correct about the numerator. That helps answer your question. Yeah.
And then Amy has some, another question about how what we analyzed as correlative factors, but Guadalupe is going to tell us a lot about that. So I think this is a good time for me to stop sharing this screen and transfer this over to Guadalupe to go into more of the details, and we'll be able to look at more maps, and then you'll get the URL so you can check them out yourself. So take it away, Guadalupe.
Thank you, Joe. So for this work, as we've kind of dived into just a little bit, we based our analysis off of CHI's root causes work. And so this is really to Amy Downs' question, which we did in partnership with the Colorado Health Foundation. So our root causes analyzed the health effects of more than 24 social factors, which served as a great starting point for us to see which of these factors correlated the most to our COVID-19 index within our data. We did the math and of course found that educational attainment, language, and racial/ethnic diversity were the variables most correlated with COVID-19 in the Denver area. If you will all give me a moment to share my screen. Okay, I believe you see my desktop. Do you all see my correlation? Okay, perfect. So just a moment here. As you can see, the correlation measures are plotted here on this graph. And so the strength of the correlation for each variable is determined by how close the measure between the two variables is to the number 1. So the takeaway here is that the numbers most to the left of your screen are those that are not as closely related to our COVID-19 index diagnoses variable, whereas the ones to the right are the ones most closely related to our variable. So you can see here on your left, we looked at factors such as essential work, no internet, undocumented, ages 20 to 34, a variety of them. But really what we found is the 3 variables to the right in the yellow area were the ones that were most close to 1 and therefore most correlated to our variable. They are the measures of education, language, and race and ethnicity, which I will explain in a few. A couple of things to keep in mind with what we're talking about today is that we are thinking about correlation and not causation. So while education, race, ethnicity, and language are closely related to each other and our data on COVID-19 diagnoses, it is important to know that there are more underlying root causes behind the patterns that we are seeing here when we look at these maps, such as inequities in income or discrimination. And so we did not dive into those, but we are acknowledging that these are simple correlations only. So I'm going to stop sharing my screen and switch over. Or actually, can you all see my maps now? Yes? Okay, thank you. Okay. So we're going to switch over to a part of our story map. So in a slightly different way, we have designed a feature that allows us to concentrate on the most affected neighborhoods in the Denver Metro and Weld and Larimer County regions. And so here we're looking at the areas in purple. They are within the highest quintile of COVID-19 diagnoses in our area. So now we're going to switch over. So this tool allows us to kind of toggle between our 3 indicators. Here we're looking specifically at educational attainment. And so residents who have less than a high school diploma. We can see an overlap throughout the upper half of Southwest Denver here. And I'm zooming out a little bit to just kind of see the region in general. And the most northeastern part of the inverted L, which is over here as well. So we're seeing overlap with the indicator in our COVID-19 diagnoses. We also see this in northern Colorado as well, specifically north of Fort Lupton and Greeley. And so if we zoom in closer to Greeley specifically, this census tract in general is the site of the JBS meatpacking plant. And as you probably remember, this was the site of numerous outbreaks early on in the pandemic. And this is important to acknowledge as workers with lower paying jobs were not able to telework as others did, as was mentioned earlier. And this example really emphasizes how COVID-19 disproportionately impacted some neighborhoods more than others, specifically those with educational attainment and without the means to telework. And remember that these patterns are not solely due to the individual choice to not go to college, but more to the systematic and institutional level barriers that make it harder for historically marginalized groups to be able to pursue an education as easily as others. So this is the data for that. I'm going to switch over to our second indicator, which is our percentage people of color. And so again, the census tracts in the green indicate the quintiles with the highest percent people of color. We again see a similar overlap between racial and ethnic diversity in our index. We again see the inverted L here. We see a little bit more coverage in Southwest Denver and about the same coverage at the top eastern part of the inverted or upside down L. We see overlap as well in areas such as South Thornton, closer to Commerce City. And so zooming in specifically more to the Commerce City area, which is around here, you can see areas such as Globeville, split essentially right by the I-70 corridor. Sorry, I'm zooming in and out. And so the I-70 corridor is here, and you see, right, a lot of neighborhoods or census tracts lighting up. And specifically zooming into Culver City, that is a heavily industrialized area and near the major Suncor refinery. As a matter of land use policy, polluting industries are built in low-income neighborhoods that are often home to people of color. And so you can really just see that here, areas outside the inverted L aren't lighting up, whereas areas inside are. Now I'm going to switch over to language. Just a moment here. Okay. So here we're seeing neighborhoods that are lighting up in the bright orange as the neighborhoods that have the highest percent of people who do not speak English at home. Again, we're seeing the same patterns, the same overlap as our other indicators. I would like to point out specifically the differences between a neighborhood that we all might know of, which is Central Park. And so that is this area right here through MLK, Martin Luther King Boulevard. And there are differences. If you think about it, this neighborhood of Central Park is very near North Aurora, which is this area right here. And so what these two neighborhoods have in common is that they are in very close proximity to the University of Colorado Hospital and the medical campus Anschutz. I bring this up as language has been the most informative yet unavailable demographic that is able to help us unravel these patterns in disease distribution. A recent Denver Health study looked at Latinx patients that were hospitalized for COVID-19, and it found the participants did not take COVID-19 as seriously because the messaging on the risks of infection came from people who did not look or speak like them. Also, that the messaging was not culturally accurate to their understanding or at comprehension level, missing the message of prevention in general for these Spanish-speaking study participants. For your reference, the study is linked in our story map. The study helps not only explain the patterns on this map related to language, but also the importance of culturally competent communication during times of emergency, and how it may be enough to live nearby a thriving hospital area, how it may not be enough, to live nearby a thriving hospital area and community. So now I'm going to show you the last tool on our map, last series of tools on our map. So this is another way to view our maps. And this section of the story map here really helps explain and illustrate the relationship between COVID-19 and our three indicators. It allows you to click on any neighborhood essentially, and the maps are synced. And so you can see on your left our COVID index with the orange, and on the right, you can see our indicators. And so here we're looking at education, and you can see, for example, if we choose an area such as Westwood that we've talked about, the COVID index again was 266 higher than average, and the percent of people or residents that have less than a high school diploma were at 30.7%. Whereas if we click on an area such as Baker, they had a 67% lower than average COVID-19 index, and the percent less than high school diploma was at about 9.8%, so lower, and a lower overall education, number of people who don't have a high school diploma, and also a lower COVID-19 index. And so these comparisons do exist for our other indicators as well. And so here, for example, we have percent who do not speak English at home, and it does the same thing, it syncs up. And we also have this same tool for our percent people of color as well. And so, yes, we invite you to explore these side-by-side comparisons to get a better sense of how lower access to an indicator is related to higher diagnoses of COVID-19. And now I'll pass it over to Joe, and I will stop sharing.
All right, thank you. So that we are now at a point where we can take some more questions. So use that Q&A field there. I'm going to jump back to a question that Bethany Prey asked earlier in the chat. She asked asking about East Boulder. Has some larger mobile home parks. Do our data allow us to look at age categories? I'll answer that first, and then I'll have Guadalupe correct me. Yes, we did get age with this. Courts allows for, I think there's an age and a race ethnicity identifier, but what we don't have in a lot of cases is the sample size to then do that by each census tract. So we can look at the overall court's population and age, but not tracks. Is that, did I get that right?
Yes, yes, I would agree with that answer.
Right. All right, another question. In the map, Guadalupe just showed the side by side. How do you get the pop-up boxes to display online? And you know what? Let me share our URL here. This is a tiny URL, so you don't need to type coloradohealthinstitute.org/blah blah blah. Just type colo.health/COVID tracts, all one word, all lowercase, and that will take you to the this story map. So let me yeah, I'll turn that over to Guadalupe. Can you answer Cindy's question?
About how to get the side-by-side maps to appear?
Yeah.
Yes. So on the story map, if you're able to navigate to that map, so essentially there's 3 sections in our story map that are specifically geared towards our 3 indicators. And I could share my screen if that's more helpful.
Yeah, let's do that.
Let me see. Okay.
And she's saying not the maps, but the display boxes.
Yes. So let me see if I'm answering this question. So if we allow this to load a little bit. So this is, for example, one of our side-by-side maps. And so if I'm not mistaken, the question is about these pop-up boxes at the bottom. How do we get those to display, the white ones?
Yes.
Okay. Yes. So this should work. Keep in mind, because there could be like a number of people on the server, right? It could slow it down just a little bit because it is a lot of data to load. But essentially, there are sections for educational attainment on your left here. There's a section on language, for example, as well. And then there is a section on race and ethnicity. And so each of these sections with just the name of our indicator has these side-by-side maps, and it allows you to click specifically on Census Tract. They are synced, and a pop-up should pop up on both maps to show you the information that it should. So for example, neighborhood, county, the index, and then on the left, it's on the right is the indicator. I hope that helps.
All right.
Getting a variety of other questions. I think we have a question from Megan. Has there been any opportunity to correlate these rates to COVID vaccine sites and density? Not, and Joe, feel free to jump in. I don't think we've been able to have the opportunity to do that yet. We do have, with our vaccine equity maps that we are updating on a monthly basis. We do have that data. We do have it by Census Tract, which we have this data as well. But we have not been able to pursue the opportunity that I know of.
Yeah, there is, that's a great idea, and we want to do it. So we at CHI and a lot of others have produced a bunch of maps about COVID. And what we hadn't had until now is what did COVID actually do? So we have maps on vaccines, we have maps on various risk factors. And that's what our next step here is, which my CHI colleagues are going to come and throw a glass of water in my face when I end the webinar, is to do more maps and overlay with, do a little bit more demographic overlay perhaps, and then these vaccine uptake, and if possible, vaccine access through clinics. CDPHE does some really good GIS tracking on where the clinics are. And I know our public health partners have really kind of used or identified the gaps there to do pop-up clinics, because in we find, you know, a lot of vaccines, I think currently around half or so in the metro area, are being done through pharmacies. And a lot of these areas that you'd seen in the darker orange on the maps we just looked at, there aren't a whole lot of pharmacies there. So the the built-in infrastructure for vaccine access just wasn't there, and we had to do pop-up clinics and outreach events and all that. So yeah, definitely the next step is to combine the illness map with the prevention maps. What else do we have here? No open questions. Anything in the chat? All right. Well, if that's, I think I'm seeing good discussion here, and please keep that going. But if it's okay with everybody, I'm gonna switch over. Thank you very much to Guadalupe, who basically the day she joined CHI, we threw this project at her, and she came through and it confirmed really confirmed why we wanted to hire her in the first place. So if you see her out and about now that we're all getting out of the office, say hi and throw her some work. You won't be disappointed. So we're gonna switch over now to our final topic, and this will be fairly brief. A lot of you have probably already seen our map of our financial map, much different sort of map of the American Rescue Plan app. I can share the URL right away. It's calo.health/ARPA map, but ARPA is uppercase in this case because we like to keep you on your toes. So now I'm going to show you the map, and here it is. You'll need an 11 by 17 piece of paper to print it out full size. And first, this map tracks funding only from the American Rescue Plan Act, or ARPA, which is the latest in a series of stimulus bills that Congress has passed since spring 2020. Colorado as a whole, Colorado and its people and businesses got about $27 billion from ARPA. And most of that was in the form of direct payments to individuals and businesses, like the famous $1,400 checks, unemployment benefits, aid to restaurants and airlines. This map tracks about $10 billion of that 27 that goes to specific entities or public agencies. And this is money for which there's a policy decision to be made on how to spend it. Now, the first row here of colored boxes are federal agencies. ARPA channeled the money through various federal agencies, and each of those agencies has issued detailed rules on how the money can be spent. It's known as guidance. The second row in the map shows the agency in Colorado that has received the money. So for example, on the left in green, we see US Treasury sending money to the state government, the legislature, and then also to county and city governments, those other two green boxes. Treasury issued guidance on how cities, counties, and states can spend the money, and it's actually pretty loose. There's quite a bit of latitude for city councils and state legislatures to decide how to use this money. And this pot accounts for about 60% of the money we've tracked in this financial map. But so far, I think this stream has gotten about almost like 100% of the attention from the public. The point of this map is to show that there are many other streams perhaps they could be combined to do even more. So this is just a little bit of a condensation of the top row of the map. You see the two biggest agencies by far funding are Treasury and the Department of Education. So this is aid to school districts, state and local governments. Then we also see, you know, big part in airport and transit spending from the Department of Transportation. We see a bunch in childcare, bunch in public health from Centers for Disease Control. This is, you know, funding for really COVID combating activities, lab work, vaccines, public health campaigns. A lot for 133 million for safety net clinics, essentially. A smaller pot for housing, although, as I'll show you in a minute, that is far from the least of it. And then, yeah, let me just go on a little bit here to look at the really big pot here, Treasury's funding to the state. So the legislature took the first steps just last month on how to start spending the state's share of that, which is $3.8 billion. Much of or almost all of it, goes into what we at CHI are just calling a holding fund. 3.5 billion of that 3.8. And then through that holding fund, it makes its way to other funds. But right off the top, the legislature took $380 million to fund the transportation bill that they passed. Then from the holding fund, we see $850 million going into economic development, and then $550 million each into mental health and housing. But most of this money is not going to be spent until at least next year. The legislature did appropriate $100 million each in mental health and housing to be spent starting now, but the decisions on the rest of it will be saved until the 2022 session. And those decisions are going to be informed by task forces that start meeting quite soon to make recommendations on how to spend it before the session begins, or how to spend it with those recommendations ready for the session, which begins next January. There's also a few pots of money that are even more wide open. So the legislature has $1 billion that can just be used for really general government purposes under the ARPA rules. And then there will likely be about $300 million for Governor Polis to send to his state agencies of choice. So bottom line here is most of these dollars are not going to be out on the street this year. There's going to be a public process to craft the strategy for spending a large part of this money. And I think we would all do well to be involved in that. Now, let me show you an example of what we're talking about when we say let's combine funding streams. Down here is SAMHSA, Substance Abuse and Mental Health Administration. $51 million that went to the State Office of Behavioral Health, or Department of Human Services. And this is just ARPA. There's a nearly equivalent amount from the CARES Act and other stimulus bills. That amounts to, you take all the stimulus bills for behavioral health together, it amounts to quite a bit more than the State Innovation Model, or SIM, the $60+ million grant that powered a lot of work in behavioral health in Colorado for the past several years. Just to give you an idea of the amount of money we're talking about. So there we go, 51 million. And not trying to pre-spend or spend Office of Behavioral Health's money that they have to use for health improvements around the state, but there are opportunities for leverage here. First of all, there's childcare, and we know that there's a big crying need, especially in my house with my 4-year-old, for mental health supports for little kids, and the pandemic has just been hard on a lot of them. There's also funding that school districts have, and we know those mental health supports are needed in for older kids as well. And then there's this money that the state legislature has already started to prioritize for behavioral health, $550 million out of this pot. And then you throw in the cities and counties as well. And you see there's an opportunity to have some partnerships, schools, local governments, state government, state and state agencies working through the legislature or directly with funding from the federal government. That the point of this financial map is you can do, there's a lot of money, and it can be, perhaps even amplified even more. And again, this is just American Rescue Plan Act, where there's already money that's arrived from other stimulus bills as well. So this last graphic here is just to kind of show the by topic, and these are topics that CHI has assigned to it that seem to make sense, of what the money can be used for. This graphic accounts for some of the decisions the legislature has already made. So in addition to the 600 some odd million dollars that the Department of Transportation is sending, the legislature also put in another 380 million transportation. So $1 billion of Colorado stimulus is going to transportation. Housing, I showed you there's tens of millions from housing and urban development, but the state is spending a lot of its money in that area as well. And then general government, as far as we know, most cities and counties have not settled on their spending decisions. They are wisely trying to take this slow and think strategically about it. So that's this general government, probably as the next year or two goes by, will come up in some of these other categories over here, be transferred over to that. So that is that with the ARPA financial map. Again, our quick links here, and we have a couple of minutes if anybody has any questions or comments or discussion, suggestions. I'll give it like one more minute. Otherwise, yeah, thanks for the comment, Mark. All right. Well, I think then we will allow everybody to refill their coffees before Thursday gets going in earnest. So with that, on behalf of Michelle and Guadalupe and everybody at CHI, thank you so much for attending, and we will see you again next month, middle week of August, and still firming up the topic, but I believe it's going to be on the mental health co-responder programs that are getting a lot of attention here in Colorado and around the country. So thanks a lot, and have a good day.